Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. Did you know that oral health is an important part of health and well-being? The World Health Organization says 3 out of 4 people living in low and middle-income countries are affected with oral health diseases. Today on Sound Health, we'll take a look at how to achieve good oral hygiene. The conversation begins after this break. Please stay tuned.
Around the world, oral health is challenged by many diseases and conditions, and there are stark and persistent inequalities in access to oral health care. Dental caries, gum disease, tooth loss, and oral cancers are among the most prevalent non-communicable diseases globally, affecting almost half of the world's population. The good news is that many oral diseases can be prevented and treated with cost-effective interventions. But to scale up access to those interventions, all countries need sufficient health workers trained in oral health, and oral health services must be included in national health coverage packages, either free of charge or at a price that people can afford.
Joining us via Zoom this evening is Dr. Funmi Adeniyi, Clinical Director and Founder, Luxe Dental Clinic Limited, and she is going to take us through proper oral hygiene. Good evening, Dr. Adeniyi, and thanks for joining us.
Good evening. Thank you very much for having me on the program.
All right, Dr. Adeniyi, the World Health Organization says 7 out of 10 Nigerian children have tooth decay right from their childhood, and if it goes on, they leave these diseases untreated, and it also leads to other health conditions. How did we get here?
Okay, so neglect for oral care, high consumption of refined sugars, reduced practice of daily oral care habits, brushing twice daily, flossing daily, has gotten us where we are, and a lot of ignorance about oral care, oral hygiene has gotten us here, and that's why many dental clinics, many dental practitioners are out there increasing advocacy for oral health care, because a lot of these disease conditions are highly preventable. More than 80% of oral diseases are preventable with the right dental practices inculcated in the lifestyle and proper hygiene. And so that's why we're here again today.
Okay then, Dr. Adeniyi, what's the difference between, let's start with this, what's the difference between oral hygiene and dental care? Is there any difference between them?
Okay, so oral hygiene has to do with the personal practices that a person inculcates daily, brushing your teeth in the morning and at night, flossing after meals, rinsing out with water, and just generally cleaning themselves, their personal hygiene. While dental care involves professional care also, which involves your 6 monthly visits to a dentist, which involves making sure that once you notice any disease condition, you're visiting your practitioner to help alleviate whatever is arising. And so I think that's the slight difference between them.
All right, for most people, they feel just brushing, we brush our teeth every day, and that is a normal routine. Let us know when or what are the signs of poor oral hygiene. When do I start noticing these defects?
Okay, so first thing is that your toothbrush is not enough. And then even when you use your toothbrush, there's a right way to brush. Many people do not brush well. There's a right equipment to use, a soft to medium brush. So if you notice that you use hard toothbrushes, you're already in the wrong lane. If you use toothpicks, you're already on the path of destroying your oral your teeth and your oral mucosa. And so the first thing is doing it right. And then when we get it right, we can now progress. So once you brush your teeth, then you should brush twice daily. You should floss. You should be using a soft to medium brush. Your toothpaste should contain fluoride, especially if you live in Africa, to help combat against oral diseases. So when we cover this, then we have just started, and then we can move on to other things then.
All right, take us through the signs of poor oral hygiene now. When do we start to notice?
Hygiene. Okay, so first thing first is there's something we call plaque. That's like a thin film of dirt and bacteria that lies on your teeth. And the point of brushing regularly is to break this cycle and to take off plaque. Over time, plaque, when your saliva supplies calcium to plaque, it becomes hardened and it becomes calculus over time. Calculus then begins to make more havoc, and then you begin to have gums that bleed when you brush. So once you notice that you bleed when you brush, you know that there is a disease condition already. When you notice that there is a lot of, you have bad breath, even after brushing, there's still a consistent poor smell that comes from your mouth, is an indication that there's something amiss and that needs to be rectified. When you notice that your teeth begin to move, your teeth are drifting, they are mobile, they are tender to touch, there's a lot of pain when you speak, and it shows that there's something wrong. So these are slight indications that show that there's something amiss in the mouth. And usually you visit to the dentist, in 30-40 minutes, we begin to sort out all these issues.
All right, is oral hygiene in children and adults the same?
Oral hygiene, oh yes, it's the same basic principle throughout life. Brush twice daily, floss daily, use a fluoride-containing toothpaste. Okay. Yeah, that's basically it.
Because I've
visit your dentist every 6 months, which is what crowns it all, because your toothbrush and your toothpaste is still not enough.
Okay, because I've heard some parents, young parents, say a baby is still about 6 months, you don't need to brush his or her gum and all that. So does this, we're talking about the basic foundation for a child now. That's why I'm asking if it is the same.
It's the same. It's the same. I like to say that once a child is born, when you create the routine of giving a bath to a child twice daily, you feed the child every 6 hours or every 4 hours, it's best that from birth you begin that practice of once they wake up in the morning, before they have a bath, run. When they're younger, you can just take a soft cloth or a tiny towel around your finger and just run it around the mouth. There's milk particles that are there, formula, if you give them formula. So you help clean the tongue and clean the process. By the time they're about 4 to 6 months and they're beginning to erupt teeth, we have silicone brushes you wear on your fingers and you use to clean them up. By the time they're in there, they graduated to using full-on toothbrushes. Sometimes by the time they're 8 months, they can graduate to using toddler brushes with a very tiny, smaller than a rice grain of toothpaste. And then there's toothpaste that's specific to them that contains fluoride that is recommended for their age that you begin to use to clean their mouth. And it's the same process, cleaning twice daily. And then when they begin to develop more teeth, I have a 1-year-old, he already has several teeth. We floss for him also because food gets stuck in between their teeth to dislodge that. So it's the same process throughout life.
Okay, are there health conditions linked to poor oral hygiene or oral hygiene?
I didn't get that question, please.
Are there health conditions linked to oral hygiene or poor oral hygiene?
Oh yes, we say that your mouth is the mirror of your body, and most of the time, systemic conditions have oral manifestations. So people that have diabetes, Alzheimer's, dementia, there's a link between heart disease and oral hygiene. So when you have more accumulation of plaque and calculus, there's higher tendencies that you will have high blood pressure, you will have heart conditions eventually, and then dementia, Alzheimer's, things that have to do with your mental faculty. There's a link between that. There's once you have diabetes, or there's a kidney condition, or you have oral manifestations or that. So there is a link. Your body is an integral part. Your mouth is an integral part of your body. And we like to say that your mouth is the mirror of the body. And so it is not separated. Everything happening in your mouth is linked to everything happening in your body. So once you take particular cure of your oral health, you notice that you begin to feel better with your whole body. A lot of conditions that we treat in connection with medical practitioners also. And so there is a huge link. There's no difference.
Okay, earlier in your response, you pointed out that too much of sugar intake affects our dentition and all that. Are there lifestyle choices that affect one's oral hygiene?
Okay, absolutely. So the most implicated oral condition is usually dental caries, and this is caused by processed refined sugars, anything that breaks down to become glucose, fructose, which is down to your bread, your rice, your anything that has sugar. When this stays on susceptible tooth surfaces over a period of time, and then there's some natural acting bacteria that live in your mouth throughout your life. When these four factors come into play, they produce sugar acids that begin to break down the enamel, break down the hard tissue of your teeth, and causes holes. And it's important to note that your teeth is like the hardest surface that you have in your body, and so it takes an extended period of time for bacteria, for sugar to act on your teeth for you to develop holes. But if you brush your teeth twice daily, you break that cycle, and so it's not extended. So once you begin to notice that if you eat a lot of fruits and vegetables, you can reduce this incidence. Once you drink a lot of water after you consumed sugary materials, you reduce this incidence. Once you brush your teeth in the morning and in the night, you break the cycle, because many times we eat all sorts throughout the day, then it's time to sleep. Our mouths are closed for 6 to 8 hours, and you don't brush, so you increase the likelihood of all these activities happening in your mouth. But if you break that cycle by brushing at night, there's no sugar particle, there's no glucose for the bacteria in your mouth to act on, and so there's nothing happening. But if you do not break the cycle, it just keeps happening night in, night out, and after a while you notice you have holes, you notice you have disease conditions in your mouth. Okay. I hope that answers the question.
Yes, okay. So at what point do you recommend surgery, removal of a tooth or teeth? At what point do you recommend that? Because we've seen cases where people say, I'm going to the dentist to remove my tooth and all that. So at what point do you recommend that?
Okay. Usually, when people come down with curious lesion holes and they remain untreated for a long time, it has gone from your enamel, that's the protective covering of your teeth, into the dentin where you have your nerves, and then into the pulp where the blood vessel, the life source of your tooth. When it affects that place, usually we opt for a root canal therapy, but in some cases, some people come really late and they've lost a lot of tooth structure, and there's really nothing to recover, to restore, and so they lose the teeth. In also instances where people have third molar, that's the last tooth at the back, is redundant, it's causing a lot of pain and discomfort for the patient, it's beginning to cause curious lesions on the tooth adjacent to it, find it because there's food packing. In that case, we also recommend for the removal of the teeth. But I like to tell people that if you keep good oral hygiene practices, you visit your dentist every 6 months, the likelihood of ever getting an extraction can be reduced to 10% out of 100%. So good oral hygiene practices, visiting your dentist every 6 months, highly reduces this incidence.
We've seen cases where some people will tell you, I cannot visit the dentist twice a year, not even once a year because of finance and all that. I can't brush my teeth twice. Is that actually an excuse? Is access to dental care expensive or affordable? Is it accessible?
No, it's not an excuse. If you see your dentist every 6 months, all you'll be doing many times is your dental check and your dental cleaning.
Okay.
And if you spread the payments for these over 6 months, if you spend around 3,000 to 5,000 naira a month and say this is for my dental care, many times you are covered. If you invest in having health insurance, there's a lot of health management organizations these days with a limited amount, it gives you access to see a dentist at least twice a year. And so it's just about priority. That's what I see it as. It's about prioritizing your health and putting it first. So if you set up a plan with dental clinics, in my clinic we have a family card where the more you are, the more discounts you get on treatment. It's just about priority. I think everybody can. The average Nigerian can afford dental services. It's just about putting it first and determining that this is important and I will make it happen.
It's all about being intentional, so to say. Okay, so is it possible dental diseases are hereditary? Have you seen cases where they're associated with genes?
Okay, so I like to say that oral health practices are usually hereditary, and so you perpetuate what daddy had and what mommy had because you are behaving like daddy did and mommy did. Some people have crowded teeth, and so it predisposes them to having more carious lesions, more gum disease. In this instance, you should be visiting your dentist every 6 months. Sometimes the dentist might say, you need to get braces to help to rearrange these teeth. If they're well positioned, there's less likelihood of having repeated carious lesions. There's less likelihood of having extractions done because of poor oral hygiene. But if you say, no, this is how my daddy's teeth were, I'm fine, and then you don't brush twice daily just like daddy did. You eat a lot of sugary stuff just like mommy did. So you create the same pattern that happened in your parents, and then it's beginning to look like a hereditary thing, but no, it's not. It is the oral health practices and decisions that your parents make that you are reproducing. But if you change your lifestyle, if you make better decisions, you will see that you have better oral health outcomes.
Okay, Dr. Adeniyi, share with us basic recommended oral hygiene or oral routine.
You brush your teeth first thing in the morning and last thing before you sleep. Once you brush at night, there's no more consumption of any sugary thing, of any food whatsoever, because as I said, even yam, red rice still breaks down to become sugar. So you brush last thing at night. You should use a fluoride-containing toothpaste because a lot of research has proven that it helps to fortify our teeth against sugar acids that help to break down the teeth and cause oral lesions. We should floss daily, a dental floss. Avoid the use of toothpicks because they damage the oral mucosa, they can break in your gums, they help to increase the spaces between your teeth. It just causes a lot of harm. No hard toothbrushes. You should be using a soft to medium brush. Drink lots of water to help to rehydrate and to help to cleanse the oral cavity. You should visit your dentist every 6 months. I can't overemphasize that because your toothbrush and the oral practices are not enough on their own. So that's basically it. Basics.
Okay, all right. Are there alternatives to fluoride toothpaste? For instance, now the World Health Organization says 7 out of 10 children, especially those in the rural areas, have poor oral hygiene or experience dental diseases. They use due to the fact that they use other alternatives. Would you recommend this?
Will I recommend fluoride-containing toothpaste?
No, other alternatives like chewing sticks. We've seen people use some herbal products in place of fluoride toothpaste.
So I like to say that absolutely I believe that we have local products that are good for oral health, but we don't have enough scientific research to back the quantity, the method, that there's so much that comes into play when something is endorsed. We haven't done that. So we need to look inwards in Africa especially. We need to look at our homegrown solutions backed with science. It's not enough to say grandma used this. We need to know quantities. We need to know what are the active ingredients in this. My mother is a pharmacist and she has carried out several research. Some of my professors in dentistry have carried out several researches. And we're seeing there's some species of trees that if you use the bark to brush your teeth, it helps defend against oral diseases. But we have not invested enough to be able to patent these things and say, when you use this exact toothbrush or this exact chewing stick, this is what happens. And so that's the missing link. We need to invest. We need homegrown solutions that is backed by science. I think that's where the Chinese have taken their own a little further, and so we need to look inwards. But it's not enough to say, oh, people use charcoal and then you just burn any tree. You don't know what is the active ingredient of this tree that you're burning. You don't know what it's doing to your oral mucus. I had a client who came in with her daughter and she had used burnt charcoal because she was told, oh, it helps to brighten the teeth. But then they began to react to this burnt charcoal. Their oral mucosa was looking burnt, like something had burnt it, and they constantly felt like their mouth was on fire because we have not researched, we have not invested enough to find out what it is that works and what doesn't. So that's my stand, really.
Okay, I'm afraid time is not our friend today on the show, but let's briefly talk about halitosis, which most people call mouth odor. Yeah, I've seen cases where people use or follow all the daily routines you mentioned, but they still end up with mouth odor. Is there a quick response to this? Is there a solution to this?
So there are many things that could cause mouth odor. From physiologic mouth odor, that's when you just wake up in the morning, your mouth has been closed for a long time, or you are fasting, you've been without food and water, your mouth is closed. That could cause mouth odor. But usually once you brush, once you drink water or you eat food, it reverses. In some cases, when you have dental caries, that's you have a hole in your mouth. There's a lot of tooth decay happening. There's bacteria acting, degenerating food. That will cause mouth odor. No matter how much you brush, if you do not fill that hole, if you do not get rid of the putrefaction, that's the decay happening there, you will have mouth odor. In cases where people bleed when they brush and they have gum disease, there's a lot of bleeding, movement of the teeth. Until you solve that condition of periodontitis or gingivitis, you will not reverse the mouth odor. Sometimes the systemic things happen. You have tonsil stones that cause terrible mouth odor. You have lung disease. You have reflux disease. That's acids coming out from your tummy into your mouth. Until you solve that root issue. Sometimes in diabetes, you have ketone breath, or in several systemic conditions that have oral manifestation. Until you solve those disease conditions in conjunction with your doctors, nothing will change. And so visit a dentist, find out what is it that is causing oral bad breath, and then you can find a solution to it.
Truly, the mouth is a mirror to our body. It is an indispensable part of health and well-being. Dr. Funmi Adeniyi, founder and clinical director of Luxe Dental Clinic Limited. Thank you so much for your time and expertise on sound health today.
Thank you very much for having me.
All right, I have been speaking with Dr. Funmi Adeniyi, clinical director and founder Luxe Dental Clinic Limited, on achieving good oral hygiene. Sound Health continues with trending health reports from around the world. Please stay tuned. Wow, this is why we say thank you on today's episode of Sound Health. Oral hygiene is an important or essential part of our health and well-being. You need to be intentional. It goes beyond just brushing your teeth. You also need to brush it twice daily, floss regularly, as well as see your dentist regularly. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.
Find amazing treats for everyone this holiday with Showmax. Celebrate like a champion with soccer.
Very well taken.
Find your festive inspo with our masters of style.
That's what I'm here for.
Embark on a fun-filled global adventure.
Here we go.
Share your